Hi, my name is Dr. Todd Austin. I would like to welcome you to this episode. Today our guest on the show is Cindy Brown. We're recording this in beautiful Fillmore, Illinois, and that is where Cindy lives, and she's getting ready to relocate to Freeport, Florida, excitingly enough, close to the beaches. Let me tell you a little bit about Cindy. She is a blogger. Her blog is everydayunderwear.com, and she is also a freelance writer. She is also someone who has suffered from a disease known as Lyme disease, as well as Rocky Mountain spotted fever. And she's someone who's a distributor, and she's a proud owner of a mat as well. So please help me welcome Cindy Brown. So
thank you very much.
Thank you for being on the show, Cindy. And first of all, could you tell our viewers, in a nutshell, what is Lyme disease and how had it affected you and your health?
Absolutely. Lyme disease is transmitted by a tick. There is some speculation that it can be transmitted by other insects as well, but that has not been proven, like deer flies or fleas, mosquitoes, that type of thing. But you get Lyme disease when you have a tick attached to you, and it is attached for a long enough period of time to start transmitting that spirochete. It has spirochetes in the saliva and in the fluid in the tick, and it will transmit that into your blood system. And Lyme disease can be very damaging to your system. It can cause a host of problems, including horrible fatigue. I cannot even explain to you the hit by the truck fatigue that you experience with Lyme disease. It's absolutely debilitating. Fatigue is one of the worst ones. No energy to do anything. I would be lucky to have the energy to walk up the stairs. I would sometimes have to crawl up the stairs, actually, to go wake my children up in the morning, get them up, get them on the bus, come back, sleep for 3 or 4 more hours hard, and still be exhausted when I got up. Even doing a load of laundry would just completely wipe me out. I also had rashes all over my body, hives, all sorts of skin manifestations that something was going on, numbness and tingling in my head, ear problems, jaw problems, dizziness. Some people have heart palpitations. Some people can have heart attacks. It can be completely debilitating. Seizures. You can be bedridden. Many people are disabled, and you can die from Lyme disease, which I didn't realize before I got Lyme disease. And some of those symptoms overlap as well with Rocky Mountain spotted fever. Actually, I did not even know that I had Rocky Mountain spotted fever. It came up in my test results when I was being tested for Lyme, because I've been unlucky enough to have Lyme twice over the past 4 years.
Okay. And so we're recording this in June of 15, and you were diagnosed with Lyme disease in 2011.
Yes. Well, I got it in 2011. I was not diagnosed until the fall of 2012.
Okay. So obviously you started having symptoms in 2011.
Started having symptoms about 6 months after my bite, and I was treated after the bite initially with enough antibiotics that it should have killed it, and it didn't. My case, it did not take care of it, and then the spirochetes just kept multiplying and multiplying, and it started causing more and more problems in my body. Doctors could not figure it out, couldn't pinpoint what the cause was. I went through all kinds of doctors, all kinds of misdiagnosis for a year and a half before I was finally diagnosed with Lyme, and then the light bulbs went off and we were able to start properly treating.
And from what I understand, that's totally not uncommon with Lyme disease.
No, not at all.
Doctor, and no one figures it out for a while. So,
yes.
So
it's known as the Great Imitator. It can imitate so many other diseases like fibromyalgia. MS is another one. And so it's really difficult to pinpoint what's going on with your body.
Definitely. So The next question I'd like to ask you, Cindy, is how did you hear about the mat, and what made you decide to try mat therapy?
Okay, that's easy to answer. I learned about the mat from you, Dr. Todd.
Thank you.
Todd just happens to be in my Toastmasters group, and I knew that he was a distributor of the mats. Did not really know anything about mats or mat therapy, but I knew that all of my Toastmaster members had mats. Almost every Toastmaster owned a mat. Yeah, odd, I don't know. So I was kind of, it was in the back of my mind, well, this is interesting. I might want to learn more about it. And I noticed as time went on, the Toastmasters would tell me, I can't live without my mat. If I go somewhere for a night, I take it with me. I sleep on it. I have to have it to feel good. They really loved their mats. And that was a huge testimony to me. And I started thinking about my own health problems and that it would be nice to have one and maybe try it out. I wasn't too sure yet because there are all sorts of therapies for Lyme disease specifically. From natural therapies to antibiotics, long-term antibiotics, which I've also done and which, did fail me also at one point. So there are a lot of options with therapies, but I found a Lyme literate medical doctor, and he had recommended to me either sauna therapy or hot tub therapy, because raising your body temperature to 104 degrees at least 3 times a week for half an hour, 3 to 4 times a week for half an hour, he said kills the spirochetes 15 times better than just your traditional therapy that you're doing, whether you're doing antibiotics or natural therapies. And that was important to me. So I started searching for a facility around here, physical therapy, a spa, a workout center, any place that had sauna or hot tub therapy. None. There are none within an hour of me. So that was kind of out, and I thought, now wait a minute, I think that mat heats up to 104 degrees or more, and it's far infrared therapy. And I thought, I know some people use far infrared sauna therapy in Lyme disease. So it started clicking, I think I could use the mat maybe to replace the sauna or hot tub therapy that he had recommended. So I asked him about it, told him that I was going to try it, and he said, you're good to go. If you want to do that, that's fine. And I waited until I got off of my antibiotics and the treatments that I was doing with him before I started trying the mat, so I could see what exactly the mat only would do for my Lyme disease.
Okay. I'm honored to have been the one to introduce you to the mat. And of course, like you said, I guess 4 or 5 other people in our Toastmaster club were just raving about it. And that's really how we spread the word about the mat, is we just tell other people how amazing it is and how it's affected our lives. And now you know what happens, and you just
let them try it too. And you actually brought one to a Toastmasters meeting and let me sit on it for a little bit, and then I went to your clinic and tried it there before I decided to take it home and try it. And I did get a loaner and try it for a short period of time, which was a wonderful thing for me. To be able to try the therapy, try before you buy, basically.
Yeah, exactly. So and my last question for you today, Cindy, is how has the mat helped you with your Lyme disease symptoms and with your Rocky Mountain spotted fever symptoms compared to the person you were telling us earlier in the video about sometimes had to even crawl up the stairs and go to bed for 3 hours after you took your kids to school and all that?
It helped a lot. I am almost symptom-free now. I had already been through proper antibiotic and natural therapy, but it did not take care of all of my symptoms. I still did have some residual symptoms. One odd thing about Lyme disease is that it will flare up during a full moon or if you eat certain foods that cause a histamine response, it makes your, if you have tick bites or any bites, it can make them really itchy. You can start to have symptoms if you are under a lot of stress. It will start to bring back those symptoms. And even if you are considered cleared, which I'm not sure you ever really are, from the Lyme disease, it can kind of come back out of nowhere and just really bring you down. So I was still having some of those periods after my treatment, and it may only be for a few days at a time, but there were two things that I dealt with that just never went away, and that was a feeling of pressure in the back of my head, kind of like you had a hat on all day and you took the hat off, but you can still feel where it was. Not a headache particularly, just a feeling of pressure. Okay. Yeah, and a little bit of numbness and tingling. That had never gone away. And I also had some weakness, probably from, knee to hips in my thigh muscles. Yeah, okay. Just kind of felt, I call it my wiggly legs. Just felt like my legs were just kind of shaky all the time. And I couldn't get rid of that with exercise or any of the therapies that I did. When I started using the mat, and I used the mat very aggressively in the beginning. I used the highest setting quite a few times.
Which is 158 degrees.
Correct. Use that one quite a bit to really attack the Lyme disease, anything that might be left in residual, and really try and kill it off and control. And then I used the 104 and would sleep on the 104 setting pretty often, almost nightly. I was a little bit careful at first, and if you do have Lyme disease, you are treating for Lyme disease or Rocky Mountain spotted fever or something like that, say that 10 times fast, you do want to be a little bit careful, ease into it, see how your body is reacting, because you can have Herxheimer reactions where you're killing off the spirochetes and it's making you ill because you're having die-off. So I did experience a little bit of that, but not. I could tell that it was starting to work. I got worse for a short period of time and then started getting better, and that's exactly what I wanted to see happen. And within probably a month, the feeling in the back of my head gone, completely gone. And probably within 2 months of use, what I call my wiggly legs, again, gone.
Nice.
I rarely have any of that feeling. If I, for instance, do too much exercise or something like that, or really stress my body, I can just barely feel it. But as you know, with the mat, it has cumulative effects. So if you keep using it, you will keep getting better and better over time.
Exactly.
So I'm confident that it's going to help me get rid of all of that. And the big thing for Lyme disease sufferers is the fatigue. And I tell you, it gave me so much energy using the mat, and I was sleeping on it almost every night. I did not get good quality sleep before I started using the mat, and with the inclusion of the mat therapy, my sleep was so much better. Even if I only slept 6 hours a night, it was 6 good hours of sleep. And I had so much energy at one point, it was like I had drank a pot of coffee.
Wow.
When I had not drank any coffee, I had so much energy from the mat that I was just about, I had to back off a little bit on my use of the mat because it was giving me so much energy. And that is hugely important for a Lyme disease sufferer.
Yeah. And that's because the mat increases ATP at the cellular level, which is our cellular energy. It also helps give us proper serotonin levels, which is a happy hormone, gives us proper melatonin levels, the sleep hormone, so that we can get more deep restorative healing sleep. So that's pretty awesome, Cindy. So thank you for your testimonial. Thank you for the opportunity to have you on the show. And if any of you folks out there have Lyme disease, please feel free to contact Cindy as a resource. So thank you for being on the show.
Thank you. Anytime.
Have a great day and happy planning if you're lucky enough to have one.